A to Z video series on topics to do with pregnancy and perinatal mental health. My name is Dr. Erin Bow and I'm a clinical and perinatal psychologist and a childbirth educator in the Macedon Ranges in Victoria. And today we're up to the final video, the letter Z. So today is going to be a little bit of a short summary, I guess, of a lot of the techniques, principles, things that I've talked about throughout the whole video series. Which sort of all draws into this idea of finding your Zen in labour, which I guess really just comes from this principle that, you know, birth doesn't have to be this horrific, negative, scary, medicalized experience. It can actually be really positive. It can actually be, I wouldn't want to use the word easy, but it can be manageable with the right support, with the right preparation, you know, with the right techniques and the right knowledge of how your birthing body works and all those sorts of things. So I was thinking about this and, you know, kind of how to put it all in a bit of a summary. And I think if you think about kind of this principle of Zen, it's one of those things that is kind of hard to explain. You can sort of give someone the right teaching, give them some theoretical knowledge, give them a little gentle nudge in the right direction, but it is something you have to experience for yourself. And I think in lots of ways, birth is kind of similar to this. So there's the process of how you find your Zen, the process of how you find a positive birthing journey is similar. And there's lots and lots of preparation that can go into it, but it's not the same as actually having birthed yourself and gone, oh, okay, yep, that's what it is. Because it is a unique situation for everybody. So in saying that, let's kind of go through, I think, the principles that are, I suppose, the most fundamental in this message I'm trying to bring across about positive birth. The first is about focusing your mind. So we know from pain research, we know from relaxation research, guided imagery, hypnosis, all of those sorts of things, that your mind is possibly your most powerful tool that you have in terms of using visualizations for labour. So whether it's focusing on the physiological, like imagining what your body's actually doing, imagining that baby coming down into that nice J shape, into the birth canal and out into the world, or whether it's something a little bit more theoretical, I suppose, like imagining a flower opening or imagining filling up a balloon, or, you know, some of those other techniques I've talked about before. It's also coming into thinking about the language that you're using. You know, is the language that you use to talk about your pregnancy, your body, your birth, is it positive, is it empowering, or is it negative, is it fearful, is it controlling, is it medicalized? It makes such a difference in terms of how our brains actually expect a situation to go in terms of our preparation. So that's really important. Also thinking about focusing the breath. It seems like such a simple thing. Everybody knows how to breathe properly, don't they? No, not necessarily. And I think in hypnobirthing, for example, we teach the really important role of those three really specific types of breath. So your relaxation breathing, your surge breathing, or your breathing that you use for contractions, and also your breathing baby down breathing. So you do use different types of breathing depending on what stage of your labour that you're in, and learning the difference between those techniques, and even just how to focus your mind back on this idea of breathing, because fundamentally the uterus is a muscle. All muscles need a good, decent flow of oxygen to work properly, otherwise they seize up and we feel pain. So your uterus is no different to any other muscle in your body in how it needs a good, as I said, steady flow of oxygen, and it also teaches your brain that what's happening to you is okay. It might not feel okay, but that it's not something to be fearful of. You know, you're not in danger. Your life is not in danger. The sensations that you're feeling when you're labouring are normal. They're expected if you know what to look for. And so teaching your brain with your breath at the same time that you're not in any physiological danger, that you're not going to die, is going to make the process just so much smoother, calmer, and easier to cope with. Doesn't mean it's easy, I just mean it makes it a little bit easier to cope with than if you don't understand what's happening to your body, your muscles seize up, your jaw seizes up, your uterus seizes up, everything slows down and you're in a world of pain. That can be prevented in a lot of cases with good preparation. Another huge part of that then, of course, is teaching and support. You can't do this all on your own. You need people around you who are positive, who have confidence in you, who can teach you the right sort of tools and techniques. So whether that's you going to a hypnobirthing class or you finding a care provider, whether that's a midwife, obstetrician, whoever you choose, that is supportive of your choice and what you want to do and is very, I suppose, birthing woman centered, as opposed to telling you what you should do based on their opinion, based on their experience, and not giving you choice. You want someone who is willing to have conversations with you about, okay, what happens if we use this technique? What happens if we use this particular maneuver? What if we wait? What if we use this intervention or don't use this intervention? You know, what are the statistics? What's the likelihood of danger, risk, injury, those sorts of things? Having the right people around you is so important, because whenever there's any negative energy or fear from other people in the birth space, it gets really, really contagious, because as I've said so many times before, birthing women are really, really, really vulnerable, and from a psychological perspective, they're very, very suggestible. So you want to protect yourself from, I suppose, other people bringing in their concerns, ideas, suggestions that are not necessarily what you want. So understanding your birth rights, your birth choices, what sort of environment you want to create, what sort of techniques you want to use or don't use. These are all important things to consider beforehand, so that you're not making decisions in a heightened state where you're in a panic. And as I've talked about before, one of the number one things that you see in couples who have a really unsatisfying birth experience right through to a very traumatic birth experience is often that they've been in a kind of fight or flight mode where they've agreed to things that they didn't actually want to agree to, because they didn't have, I suppose, the knowledge, support, tools, those sorts of things beforehand. And that wasn't, you know, in the height of what might be considered an emergency situation that maybe wasn't actually an emergency situation. It was just a heightened emotional decision-making situation, is that they've gotten caught out and they go back and retrospectively say, I wish I'd been more assertive. I wish I had someone else there who could advocate for me. I wish I had more time to think about my options, those sorts of things. So whatever journey your birthing takes is what it takes. This, I hope in some ways, like, this video series hasn't been about saying there's one way to do this and it's the only way to do it. You know, your labour has to be natural, it has to be no drugs, it has to be this, it has to be that. It can be whatever you want it to be. My goal in all of this is to give you some tips, suggestions, ideas along the way that you pick up on what you like the idea of, ignore what you don't like the idea of, and I suppose understand that it is a choice. This is your baby, your body, your pregnancy, your birth. You should be able to choose to do or not do whatever you want to do. Make sure it's an informed choice and that you're supported, because that's what makes for positive birth and positive labour. Okay, I think we're at the end. I'm still very pregnant at this stage. By the time you see this video, I won't be. So this won't be my absolute last video ever. It will just be, it's the last in this particular series for a while. But I'll see you next year in 2018 with plenty of other topics to talk about. Until then, thanks for watching. Thanks for getting through all 26 videos if you've made it this far. At the start, I never would have thought I'd actually make all these 26 videos, but you know, I made myself accountable and I did it. So yeah, thanks for bearing with me for all this time, and as I said, I hope it's actually been useful and enjoyable. Alright, that's it for me for now. Thanks for watching again. Bye.